Hello, all, and welcome to the Caregiver Support Series.
Hey everyone! I hope you are all well and have been able to enjoy some sunshine. As I said in episode 1, I am the community educator for Hospice of Northwest Ohio. I passionately try to advocate for patients and their families in our community through education related to hospice philosophy, caregiver support, advanced care planning, death and dying in general. The list goes on. It has been my responsibility to coordinate outreach opportunities and requests. And as you can imagine, those all came to a screeching halt in March. But as my brilliant brother-in-law says, winners adjust. The requests are now coming in slowly but surely in different forms. I've given online educational presentations and hosted some support groups virtually. But most of the time when I was out in the community, I was speaking about hospice in general, and some of the questions people asked used to blow me away. But at this point, I've heard it all. So I've compiled a list of the top myths I'm going to bust, and there were a lot of them. And I split the list into 2 episodes. So feel free to sit back with your favorite hot beverage, and as always, feel free to reach out with questions or topic suggestions. A myth is a widely held but false belief or idea. As you can imagine, when you're discussing something as taboo or high stakes as death and dying, a lot of myths fly around. I'm going to cover just a few of the top ones. The Education Corner will review a little bit of quality data that is actually related to some of the myths that are out there. And as usual, there will be some additional related content for you to check out. Next week's episode is Busting the Myths of Hospice, Part 2. Myth number 1. Hospice is a place people go to die. False. Hospice is actually a holistic philosophy of care. And what I mean by holistic is that it considers the entire person as a whole right where they are at, physically, psychologically, spiritually, and socially. Sometimes in medicine, there can be such a narrow focus on the disease that the rest of the person is sort of ignored. You have to understand that one organ system can certainly affect another, and being seriously ill will certainly affect a person's life in its entirety, along with their loved ones. I went over the history of the hospice movement briefly in the last episode, so check that out if you haven't yet. Myth number 2, care is certainly provided in our inpatient units, but the majority of our patients are in their own homes. We serve patients wherever they consider home, including assisted living facilities and nursing homes. The interdisciplinary team makes weekly visits, spending on average an hour with that patient and their caregivers and/or loved ones. Myth number 3, hospice care is expensive. The truth? Medicare, Medicaid, and most commercial insurances cover 100% of hospice services. And as the community's legacy nonprofit organization, we do not turn people away if they have no means to pay. While someone is on the program, their nurse, and when needed, nurse practitioner and doctor visits, interventions, medications related to their terminal diagnosis and comfort, therapies, medical equipment, 24/7, 365 support, and all other interdisciplinary services are included. I would say those are 3 of the top myths, and while I understand why these misunderstandings occur, I'm hoping that through my role, I can continue to spread the real truths about hospice. Now I will address some of the myths that include numerical data. So this myth is number 4. Hospice is only for people with cancer. The truth is that only about 30% nationwide of hospice patients have cancer. We've been seeing more of the long-term chronic diseases such as COPD, congestive heart failure, chronic kidney diseases, and neurological diseases like dementia, ALS, and post-stroke patients. The 5th and final myth for this episode is that hospice care is only for people who are in their final days. The truth is, on average, Patients are on a hospice program for about 2 months. The criteria for admission to hospice is having 2 doctors say, if the disease continues along a normal course without dramatic medical intervention, or sometimes even with it, the patient is likely to die in 6 months or less. But I always tell people, don't get hung up on that. I had patients on the program for 1 or 2 years before they passed. No one has a crystal ball. There's a well-known palliative care physician named Dr. Ira Byock who likes to use the surprise question, which is simply, when wondering if a loved one may qualify for help from a hospice program, ask yourself this question. Would you be surprised if they died within a year? If the answer is no, it wouldn't really come as a shock to you. They probably qualify. Maybe it wouldn't be a shock because they've been able to do less and less for themselves, or there's someone who struggles with multiple symptoms or multiple diagnoses and have been in and out of the hospital a lot. If it would come as a shock to you because they seem in fairly good health overall, then they probably do not qualify. Check out the videos I added to the related content section for more information on hospice admissions. For today's nurse tips, I'm going to talk about educating yourself. I'm a firm believer that knowledge is growth and knowledge is power. Do some research before you call a hospice provider. There are multiple choices in our area. Some are for-profit, some are not-for-profit, some have full-time physicians and medical directors, others do not. Bereavement services can differ between the different agencies. Sure, we all have certain guidelines that have to be followed in order to be licensed and accredited, but that doesn't mean that we go about it all the same way. There's a website called Hospice Compare where you can compare 3 different agencies against one another. One thing that as a nurse I always felt set apart Hospice of Northwest Ohio as an agency was that they paid for me to get my national certification in hospice and palliative care. They invested hundreds, if not thousands of dollars for me to prepare for and take a national exam that proves my expertise in hospice and palliative care. I think that says a lot about the agency as a whole. So think about your goals of care, what you expect from a hospice program, and don't be afraid to ask questions of your hospice of choice. Thanks for watching. This has been an episode of the Caregiver Support Series brought to you by Hospice of Northwest Ohio. Next week's topic is Busting the Myths of Hospice, Part 2.